Hello and welcome to the Evidence to Success Kearns Community Coalition orientation. We're so excited to have you here and thank you for taking the time to watch this video. The purpose of this orientation is to really give you more background into the coalition, the work that we are doing, and how you can get involved. Before we talk about all of that, we really feel like it's important to share our vision statement with you. This is a statement that the coalition came up with together and really is our dream big statement. This is really what we hope for our community of Kearns. And that is that Kearns is a unified and welcoming community for all, where individuals and families prosper, have opportunities to contribute, and take pride in a vibrant and diverse community. The coalition also developed a mission statement that we'd love to share with you. And this mission statement really talks about how we are going to achieve that vision statement and what we chose to focus on as a coalition. So our focus is that the Evidence2Success Kearns Community Coalition works to decrease youth substance use and other problem behaviors in Kearns through evidence-based programming, environmental strategies, and community engagement. So with those two statements in mind, let's talk about the background of the coalition. Evidence2Success Kearns started back in 2015 through a Salt Lake County initiative with the Annie E. Casey Foundation. And just a couple years later, in 2017, we received additional funding through the Drug-Free Communities, or DFC, grant. The coalition has one coordinator who is housed under the Salt Lake County Health Department, and the coalitions have a wide variety of members involved. These members serve in different capacities, whether being a member of the board, working on a work group, or partnering with the coalition in another way. Some of the members are listed here and include Kearns Residents, the Kearns Library, Hope Unlimited Church, Chamber West, and USU Extension. And all of these members play a vital role to the coalition and the work that we are doing. We are always welcome to invite and would love more membership and involvement in our coalition. The coalition also has a foundation in public health practices, and we felt like it was important to go over those a little bit in the next couple of slides. Evidence2Success Kearns uses prevention science to accomplish that mission and vision statement that we talked about in the very beginning. So what do we mean when we say prevention science? Essentially, prevention science is a field that focuses on developing and using what is called evidence-based strategies to improve the health and well-being of individuals, families, and communities. So when something is evidence-based, that just means that it has been developed, implemented, and evaluated, and has shown that it strengthens communities. There are different things that can be evidence-based. There are evidence-based programs, policies, and strategies, and we try to incorporate those evidence-based practices into our coalition. And this slide talks a little bit more about some of those practices. One of the main practices we use are identifying risk and protective factors in our community. A risk factor is a characteristic that is associated with a higher likelihood of a negative outcome. So, like it says on the slide, this is a characteristic in someone's life where research has shown that if that risk factor is present, this person has a higher likelihood of a negative health outcome. Some of risk factor examples are family conflict or a lack of interest in school. And kind of on the opposite end of that are protective factors, which are characteristics that are shown to reduce a risk factor's impact. So again, the more protective factors are present in someone's life, the more chance that they will reduce the negative impact of a risk factor. So some example of protective factors are positive self-esteem and strong social support. There are three main ways that the coalition uses prevention science, and those are identifying and reducing those risk factors, enhancing protective factors in our communities, and then using tested and effective programs. One of the most evidence-based framework and strategy is called the Communities That Care, or CTC framework. When the coalition first started, we used this CTC framework, and we still do, and are actually considered a mature coalition in the CTC world. One of the main strategies that the CTC framework uses is the social development strategy. And again, this is an evidence-based strategy, so it's been tested and effective to show that it motivates young people to adopt healthy standards of behavior by focusing on providing three main things: opportunities, skills, and recognition. So at this point, you can pause my presentation and watch this video from one of the creators of the CTC framework that talks in more detail about the social development strategy. So this slide really sums up what we talked about as far as how the coalition uses its foundation of prevention science to conduct the work that we do in Currents. So at the center, like we said, we have prevention science, data, outcomes, and evaluation. And then from that leads our decisions. We choose tested and effective programming that we feel fits the community's needs. We focus a lot on community collaboration and equity and want to continue growing community collaboration and equity. We also focus on strategic financing. So like we talked about earlier, we do have the coordinator who's housed under Salt Lake County, and so Salt Lake County is the fiscal manager of this coalition, but that doesn't mean that every funding stream goes through Salt Lake County. We have a variety of funding sources, and we are always looking and working to try and figure out how to keep our financing sustainable and innovative. We also use environmental strategies. And basically those are everything but programs. These could be policy, events, working with businesses, or other campaigns. Basically anything that is in the environment of the community. And again, all of this is driven by that prevention science, which is the data, outcomes, and then evaluation. So how does all this translate into the day-to-day running of the coalition? This slide is meant to explain that. So the coalition together looks at community data and decides what we want to focus on, or what we also call the priority outcomes. The coalition has chosen to use the SHARP data to determine these outcomes. The SHARP data is a statewide survey that is sent out every 2 years to students in 6th, 8th, 10th, and 12th grade. And it stands for the Student Health and Risk Prevention Statewide Survey. So the coalition, every 2 years when the data is gathered and produced, looks over local data in Currents to see what students are telling us. And from then we decide the outcomes that we want to focus on. So a couple years ago, the coalition decided we wanted to work on increasing youth pride in their community and schools, help youth understand the harmful effects of substance and alcohol abuse, which includes e-cigarettes and marijuana. We want to help families stay strong and supportive of their children, and we want to ensure our youth are mentally healthy. So these are the outcomes, or kind of the bullet points, that we are monitoring as a coalition to see if the programs, the strategies, the environmental strategies are working to achieve our goals. We just came out with 2021 data, so these outcomes may change. To monitor the changes, the coalition has chosen these priorities based off what the SHARP data collects. We chose 30-day alcohol use, 30-day e-cigarette use, 30-day marijuana use, low commitment to school, low neighborhood attachment, perceived risk of drug use, and poor family management. So these are the data points that we look at every 2 years when we are looking at the SHARP data to determine those outcomes. And again, with the new data, we could decide that some of these don't meet our community needs anymore and want to change them, or we may decide that these still are pertinent to our community and want to continue on. And I think that is one of the coolest parts about the coalition, is that it's constantly evaluating and moving and trying to make sure that we are doing the best work that we can in currents and really trying to meet the needs of the community. This slide goes into more detail about some of the programs and activities that we are currently working on as a coalition, and I really mean some, because there are so many. Some of our programs are the Guiding Good Choices program. This is a parenting class for ages 10 to 14. It's administered both in the community and online, and this program is proven to address alcohol use, depression, and poor family management. We also use the Blues program, also called Me Time, which is for high school students who show mild signs of depression. And this is administered by Youth Services and Granite School District, and this program is proven to address depression. We also use the Too Good for Drugs program, which addresses substance use. This is a Currens Junior after-school program, and it's about 10 weeks. We also, this is a newer part of our coalition, have a youth council, which we are very excited about, and the work that they are doing is awesome. But this is through Currens High School, and it's a youth council that focuses on prevention activities. They've helped with and led service projects and also family nights out. We also work closely with Parents Empowered to do underage drinking campaigns. We do drug take-back days and nights out against crime in the community. This slide goes into further detail to kind of break down those funding sources we were talking about earlier. So as mentioned, we have the Drug-Free Communities, or DFC grant, which is $125,000 a year. We have the Parents Empowered Community Partnership Project that have been working on and completed. We have an e-cigarette, marijuana, and other substances grant, and then a Teen Sphere of Influence grant through USU Extension. So this slide goes over how the work actually gets done by the coalition, and that is through the community board. Our Evidence2Success Currens Coalition is managed by the community board, and the board maintains a membership of at least 12 individuals at all times. These individuals represent the different systems, agencies, Currens residents and parents, providers, schools, and all those invested and involved and a part of the Currens area. The 12 partners or people that are on the board come from this right here, which is the Drug-Free Communities framework for those 12 people essentially, this is just to ensure that we are getting representation from every component of the community so that we can get everyone on board. This slide breaks down further how the coalition is structured and the different work groups we have. So again, we have the coalition coordinator, Cheryl Saunders, and then we have our coalition chair, who's Becky Gertler. We have our vice chair, Josh Nielsen, and then our secretary, McCall Lyons. And then we have various work groups that do the work of the coalition. This slide is a little outdated. We've had some change recently, but I'll go through each work group to talk about what each work group does and if there's a chair open. So starting at the top left of this square, we have the Policy and Youth Development work group. This work group is focused on kind of two things. A, the Youth Council, which we talked about a couple slides ago, and then B, those environmental strategies such as policy that move the coalition forward. So the chair for this group is no longer Kristen, but there's actually two co-chairs. So this is an exciting work group. There's a lot of work to be done. If you're interested in working in policy or with youth, this is a great work group to be involved with. On the right from that is the Data and Evaluation work group, whose chair is Rob Timmerman. And this work group is really involved with the data that the coalition uses. Like I was kind of referring to earlier with the SHARP data, now we have new data. It's time to look through that, evaluate our outcomes as a coalition, and decide how we want to move forward. And so this work group is really involved in that. Going to the right, we have our sustainability work group, and Kristen is actually now our chair of this work group, which is very exciting. And this work group is all about making sure the coalition is sustainable. Going down from the sustainability work group, we have our public relations and outreach work group, our PR work group, chaired by Josh. This work group is in charge of all of our campaigns, our social media accounts, and basically anything PR related. Moving down from that is the Healthy Currents work group, whose chair is Charles Henderson. And this work group is working on a variety of different projects. Right now, we're paired up with the Utah Department of Health Cancer Genomics Project to conduct a community assessment. Moving left from that is the Resource Assessment and Implementation work group. And Chandler's no longer our chair of this work group. Again, this work group is all about assessing the resources for our coalition and then how we can use that. Moving on to the left is the Board Development and Maintenance work group. This work group is all about maintaining the coalition and the board. It's in charge of these orientations, our board retreat, and making sure that while you are a part of this coalition, you are also getting opportunities to learn and grow. And this chair position is actually empty. So if this is an area you're passionate about, this is a way to be involved as well. And then moving up, we have the executive committee, which essentially is all of the chairs of every work group, along with the secretary, vice chair, and chair of the coalition. So I realize this can be a lot of information and it's a lot to sort through. So hopefully this side will break down a little better how you can be involved. The first way to become involved is to become a board member, and we'll talk more about that on the next slide. You can also join a work group, or you can just attend monthly board meetings either every month or when you can. And I'll break down kind of the time commitment for each option. So the community board member is probably the most involved position or involvement level with the coalition. As a board member, you are asked to provide input on various recommendations or issues going on with the coalition. And this is usually over email, but sometimes can involve an extra meeting. And you're also asked to provide this feedback during the general board meetings. We also ask that you participate in the development and maintenance of that Evidence2Success current elements. So all the things we've been talking about in this presentation, our vision statement, the risk and protective factors that we feel like we are focusing on as a coalition, and then our community action plan, things like that. We also ask that you decide and act on recommendations provided by the work group. So typically the work group works on the project that they're working on the time, and they'll bring that to the board for a vote to decide if this is something we should move forward on or how to move forward with the project. These are the expectations as a community board member. The first one is to be a community leader among your represented area or sector. We also expect you to ensure clear communication between the sector that you're representing and then the coalition itself. So if you are a business owner, we'd hope that you would be a liaison between the business community and the coalition. We also expect you to act as a model, a positive role model for youth, families, and peers. Support the coalition's mission and vision, attend the monthly board meetings, and participate on at least one work group. We also expect you to attend coalition trainings, town hall meetings, and community events, contribute to our strategic action plan, and participate in sustaining the coalition's capacity and involvement in our goals. So like I said, the board member position is definitely the most involved. It is also really fulfilling. So if you are up to that, then these are the steps that you will follow. In the email with the presentation, you should have been given the board member application. All you'll need to do is submit that and send it back to Cheryl's email here, csaunders@slco.org. The board will review your application and then they'll vote you in at the next board meeting. If the board member position is not going to work for you at this time, that is totally okay. We would love for you to be on a work group, and that usually has a little less time commitment, about one meeting a month plus the general board meeting if you can attend, which we recommend that you do, and then whatever work that you need to do with that work group. If those options are still too much, we totally understand and would love for your participation whenever applicable, and you can send that in an email to Cheryl as well if your time doesn't allow for being a board member or a work group member at this time. But if you still want to be a part of the coalition, we would still love to see you whenever we can at board meetings or partner with you at events or in the community in other ways. So we're very open to collaboration, and of course would love to have you as part of our board, but understand that that might not be the best time commitment for you at this time. Again, thank you for taking the time to come and watch this video and support our coalition. You can also send any further questions to Cheryl. We are also happy to set up a Zoom or answer questions over email or whatever would be helpful to you. Thank you again, and we look forward to talking with you soon.